nobody can dispute the fact that the Affordable Care Act has been a huge failure, and the only way that you can end this healthcare debate once and for all is to move towards a Medicare for All system. And what progressives are now doing, now that the Affordable Care Act has failed, is we are drawing a line in the sand. We are saying either our representatives support a Medicare for All system or they need to get out of office, and we will vote them out. So the push for a Medicare for All system got a huge boost recently when Representative John Conyers introduced H.R. 676, the Expanded and Improved Medicare for All Act. The bill currently has 98 co-sponsors, and progressives are doing everything they can to make sure that that number grows. And that number has, in fact, grown, thankfully. So, I mean, they're falling like dominoes. And at first, what we really saw was a lot of representatives getting asked at town halls whether or not they would be on board with H.R. 676. But now, people are asking their senators as well whether or not they would support a Medicare for All system. And now that we know Bernie Sanders will be introducing a bill that would create a Medicare for All system, people want to know, will their representatives get on board with this bill? So Senator Catherine Cortez Masto held a town hall in Las Vegas with her constituents, and one of her constituents, named David, explained to her that as someone in the military, the Affordable Care Act didn't actually expand coverage to his daughter because he had TRICARE insurance. Now, TRICARE insurance only applies to the children of military personnel if they're enrolled in school full-time. Now, unfortunately, David's daughter passed away because she was unable to get coverage. The Affordable Care Act left her out. It didn't cover her, and she died as a result. So David told Senator Cortez Masto his story and his daughter's story, and he asked her this very simple question.
Will you please support Medicare for All? And if we live in a country where we have Medicare for All, my daughter Shalane will still be alive.
Yeah, thank you. And thank you for coming forward. Let me just say this. Nobody should die because they cannot access health care, and nobody should go bankrupt because they can't afford it in this country. And if we're starting with that as the premise and the solution to health care for everyone, then we're going to work together in a bipartisan manner to figure out how we make that happen. But I'll tell you what, it does not start with repealing the Affordable Care Act. Because if we're going to break it down and continue to have politics, and for me, I can guarantee you this, it is about improving and working on what doesn't work right now in the Affordable Care Act and making sure we're giving everyone access to affordable health care in this country.
So I want to pinpoint the keywords that she's using there, that all Democrats are using. She said everyone should get access to health care. Well, access doesn't actually translate into health care. Access to insurance means nothing if you can't afford it. David's daughter had access to health care technically, but she couldn't get insurance and she died. So after hearing David's poignant story, her answer was no, I will not get on board with a Medicare for All system. That's effectively what she said. Now, thankfully, her constituents were not having it and they were not willing to let it go.
Why haven't you come out on the record in favor for Medicare for All? Why?
Yes!
Because we have 0 people uninsured. And it's the cheapest plan. That's it. Thank you. No, first of all, let me just say, I think with the Affordable Care Act, what works we should keep. Absolutely. And for the very reasons you said, what works, no, listen.
So understand that she was still dodging the question, but if you think her constituents were done talking about Medicare for All, that was not the case.
Yeah, so
I mean, you haven't answered the question.
Yeah, so let me answer it this way. And let me answer it this way. Let me answer this, because I appreciate that. And I know many people think that their Medicare for All is the answer. But, and it may be. Let me just answer this. It may be, but here's the fight. Here's the fight. What do we do with all of those people that have health care now under the Affordable Care Act? And how do we do that? How do we do that? I mean, right now we are fighting with the Republicans just to ensure we keep health insurance for the people who have it now. They want to repeal all of it. So what? And they're in control of Congress. They control the White House. Fear. Oh, no, I'm not. Listen, I think we should have health care for everyone. But the challenge is we have to be realistic. We can't with the Republicans in control of Congress and the White House.
So her response is incredibly frustrating because she is saying it's impossible that, now that Republicans hold a majority in the House, in the Senate, they hold the White House. However, when Democrats had a supermajority, when they held the White House, we got a Republican-light healthcare plan that Mitt Romney implemented in Massachusetts. So don't give me this nonsense that all we have to do is give Democrats a majority and you will provide us with healthcare. That wasn't the case. You botched your chance at giving us a Medicare for All system, so I don't believe you. Now, she says here, what do we do with all of those people that have insurance through the Affordable Care Act now? We give them Medicare for All? I don't get what the question is there. You're trying to imply that if we implement a Medicare for All system, that the people who have Obamacare would lose their insurance? That makes no sense whatsoever. The whole point of a Medicare for All system is that it applies to every single person. There's not a single person left out. Nobody dies or goes bankrupt anymore because they don't have insurance. So her answer is incredibly disingenuous and misleading. She is misleading her constituents. So all that she did there is lie and obfuscate when her constituents continue to call her out. But if you think that was enough for them, if you think they were willing to let it go, you're still wrong, because they were going to push her on this again.
HR 676 puts the health care in the hands of the people, not the insurance industry. We're even getting Republicans on board with this because it saves money. If we knock out the profits of the insurance companies from the 64% that the U.S. government is already paying of this pie, the U.S. government pays 64% of all the healthcare expenses. If we knock out the insurance company, the amount of money difference between what we would have to pay for insurance and what we're paying right now is nearly insignificant. If you run the numbers, which I'm just an 8th grade teacher, I'm not a mathematician, I've run the numbers and I've looked at it, and Bernie Sanders said the same thing. Universal health care is what we need and what we deserve.
Yes!
I don't understand why you won't at least say, I will support HR 676, because what harm does it do to support the bill? What harm does it do to take the challenge up with the Republicans? Instead of, you guys approve with these cabinet members and stuff like that, why say yes? Stand up and say no. I Dem exited. I am now a Green Party member because they do stand for universal health care. I want you to stand for universal health care.
Has that been introduced on the Senate side?
So
it hasn't been introduced at all?
No, but we just got Nina Titus to approve of it here.
Okay, I will absolutely take a look at it.
I will absolutely take a look at it. Okay, so we made some progress. However, what I need to know is if she's actually going to take a look at it, or if she just said that to get her constituents off her back, since they continue to pressure her on this issue. I need to know. So if you're also curious, you can ask her if she supports Medicare for All now, because it has been a couple of days. Her number is 202-224-3542. Now, you may also want to ask her if her decision to not support a Medicare for All system is contingent on the fact that she took $270,000 from health professionals and a total of $455,000 from the health industry overall. Because I think that her constituents deserve to know whether or not she's on their side or the side of her donors. And since I'm curious, I want to call and find out. Hopefully I'm calling early enough to where I can actually get an answer and talk to someone, but if not, I will leave a message because they do hear these messages.
Hello, this is Senator Catherine Cortez Masto, and thank you for calling my Washington, D.C. office. I am so sorry we're not able to answer your call right now, but I look forward to hearing from you. Please know that you can also contact my office by going to cortezmasto.senate.gov. That's cortezmasto.senate.gov. If you would like to leave a message, please do so after the tone. And if you would like a response, please include a phone number, email, and mailing address where I can reach you. Thank you again for calling.
Hello, Senator Masto. My name is Mike Figueredo, and first of all, I want to thank you for attending a town hall with your constituents in Las Vegas, Nevada recently. And during this town hall, your constituents repeatedly asked you about whether or not you'd support a Medicare for All system, and you said you would look into it, and it's now been a couple of days, and we have yet to hear back from you about whether or not you are, in fact, going to be supporting a Medicare for All system. And so we're wondering if your reluctance to support a Medicare for All system at this town hall was contingent on the fact that you took $270,000 from health professionals and a total of $455,000 from the health industry overall. So the question is, are you actually looking into it, or did you just say that so that way your constituents would stop asking you about a Medicare for All system? So I think that your constituents deserve to know. They voted for you, they supported your campaign, and I think that you should be responsive to their needs and endorse the idea of a Medicare for All system and come out publicly in support of it, because this would be the only way that we end the healthcare debate once and for all and make sure that people don't die or go bankrupt because they don't have insurance. The Affordable Care Act did not work. It's a failure. And now we need every single senator. It's incredibly important to get on board. So if you could respond to me and let me know if your position has changed at all, my email address is mike@humanistreport.com. I would love to hear from you. So thank you so much. If you can get back to me as soon as possible, that would be great, because this is a very urgent matter. Thank you. So I told you what happened at this town hall, and I showed you the footage. A lot of what was discussed at this town hall had to do with healthcare. However, if you read local media, you wouldn't get that impression. I want to share this headline with you. Cortez Masto talks Trump budget, immigration reform, and labor unions at Las Vegas town hall. There's absolutely no mention of healthcare, and they even state this. The nearly 2-hour town hall featured about 250 attendees, mostly supporters of the Democratic senator. Attendees applauded, shouted, and gave a standing ovation when Cortez Masto was introduced. The applause continued throughout the evening as Cortez Masto answered questions. Again, the article makes no mention about how her constituents called her out because she refused to state unequivocally that she supports a Medicare for All system. Now, if Cortez Masto, she's new, she was just elected in 2016, if she wants to know how to make these town halls go more smoothly, and actually go smoothly, not like, this fluff piece for her is trying to make you think it went, here's what you can do. Here's how you can talk about healthcare to your constituents.
There's a bill before the House right now called, it's Medicare for All, but it's H.R. 676. I'm a co-sponsor of this legislation. I believe in principle that we have to provide this basic level of health care to all people, supporting universal health care.
Now, during Tulsi Gabbard's town hall, there were people that literally showed up wearing Team Tulsi shirts, because people know that if you're representing them, you're genuine. You don't have to beat around the bush. They don't have to ask you literally 4 different times if you're going to support a Medicare for All system to no avail. So it is absolutely crucial that Senator Catherine Masto gets on board. Again, her phone number is 202-224-3542. Call her up and ask her, which side is she on? Is she on the side of her constituents, or is she on the side of her donors in the health industry? Be polite. Ask her to please support Medicare for All, because people are dying as we wait and as Democrats continue to defend the failure that is the Affordable Care Act.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.